Hello, our topic is talking about informing children's services in HKSAR government from the research evidence on enhancing ADHD learning in Hong Kong. I'm Vince and this is Gigi and Elliot. SEN students nowadays is about 28,000 in the mainstream school, and they are under the inclusive education policy since 1997. Inclusive education policy is about placing children with learning disability in controversial classroom, which they can develop alongside with other youngest. Academics and social workers find SEN students have broad range of needs in school. Most of them do not receive sufficient help and they struggle in classroom. However, every school will receive about 10,000 to 20,000 in addition when they enroll SEN students. Most schools turn to empowering outside speech or occupational therapist services for them, but most of them claim that they do not need such kinds of services. As a result, many parents complain their children do not get help from school. Our purpose of the research is that as ADHD children have hyperactive and attention deficits highly affect their daily life, such as self-care, academic, interpersonal relationships, and emotion. So professional and government should put more resources to help them.
So first of all, what is ADHD? ADHD refers to the attention deficit hyperimpulsive disorder. It is a neurobehavioral disorder which shows the dysfunctions at the brain's neurotransmitter system. Boys were more diagnosed than girls. According to DSM-5 diagnosis instruction, the symptom must start before age 7. ADHD persons show the long-term association on attention, hyperactive, and impulsive behavior control, which is inappropriate for the person's developmental level. And most of the trials with the ADHD also involve another mental disorder, such as mood disorder, anxiety, occupational dysfunction disorder, and learning disability. They tend to show the negative impact on the academic performance and interpersonal relationship. There are 3 types of the ADHD, including the inattention type, hyperactive type, and combined type. Inattention type tends to show the problem sustaining attention in tasks or plays, while the hyperactive impulsive type tends to show the depth of touching and playing with anything. According to the Child Assistance Service Epidemiology and Research Bulletin report, the number of the ADHD students increased 1,250 in 2006 to 3,316 in 2015. Reducing the academic performance is one of the serious problems for the ADHD student. Consistent research report and normal cognitive function and attention cause distortion, lower memory, and difficult to complete the task. Inattention behavior highly associated the learning process can be explained by the information processing model. The human absorb the information through the cognitive processing, including attention, encoding information, manipulating information, and finally in turn to the long-term memory. This indicated that the attention maintains a significant mode of encoding information, while the ADHD student is free to encoding information, so that they show the poor performance on spelling and mathematics. The ADHD is unrecoverable, but the symptom is redeemable and controllable. Present support for ADHD students on the education focus on the medication and special education policy and mental health professional. According to the education rules in Hong Kong, the existing arrangement for SEN students in education, including the funding support, professional supports, and professional development for teachers. First, funding support refers to provide the public school additional resource, including the learning support grant and the extra grant. Secondly, the professional support refers to the school-based education psychology service. We cover all schools that education psychology will be served 6 to 10 schools. The education by regular visiting school providing assessment, intervention, training for teachers and parents. Finally, the professional development for the child refers to the providing efforts course, thematic course for the in-service teacher, while supporting SEN student training program as a basic education for service teacher.
The following we talk about the presence program on ADHD students and parents. There are 4 parts. The first one is about the ADHD assessment and treatment services. It is based on this journal, and there are 3 aspects about it. The first one is about assessing ADHD diagnosis and treatment services. Parents and school play a significant role in getting referral for patients who are too young to participate in this diagnostic process. High number of patients in the public mental health services causing long waiting time for them to receive first appointment. When ADHD patients reach the adulthood, they don't know whether they need to continue with children or adolescent psychiatrists or need to transfer to the adult psychiatrist service would be better. The second is about the pharmacological treatment. Some of them think that medication was effective and satisfactory. It is because it increases attention spans and reduces hyperactive levels. Besides, it enables the management of daily activities, particularly in study and working, while some think medication is ineffective. They usually experience common side effects such as reduced appetite, poor sleep quality, and antisocial feelings, which lead them to worry about their after medications. The third is about non-pharmacological treatment. ADHD group training will offer to primary school students at hospital. For the training, group of children will play games and attend classes together to discuss about school curriculum, emotion control, and social skills. However, some say that the doctor don't offer this kind of treatment or even not aware about this kind of treatment was available. The second program is on education. Parents concede high wishes on teachers for help ADHD students. However, most of the teachers are weak on this kind of knowledge and intervention skills. School provide lack of support on ADHD learning. From 2014 research, only 42 and 18.3% of primary and secondary school teachers complete the SEN education training. So parents have a lower satisfaction towards the school support. The third program is on funding support. Reports show that on 2011 to 2012, the school year, 45 schools unspent the learning school grant from the government, which weighed 3.4 million to the education bureau. For the last program is about ADHD parents' needs. They are based on this journal, and there are 4 aspects on this. The first one is about the concepts and understanding of ADHD. Most of them have limited knowledge and understanding about the nature of ADHD. They only receive information from family members, relatives, and other parents in the same school or friends. Most of them describe ADHD as the unmanageable or problematic behavior, which lead them to delay the detecting warning signal of their children. The second is about the children care on ADHD students. All parents expect they have great difficulty in children care. They encounter difficulty in helping their children to adapt school life and fulfill the academic demands. In addition, they have time constraints to take care of their students. They have struggled to have time for care their students with ADHD children and family care and other daily activities about themselves. And the third is about the financial burden. Most of them need to give up their full-time job to take care of their children. And lastly, it's about the psychological program about themselves. They have a high level of stress and have abundance of negative feelings. And worry and anxiety is very usual feeling amongst them. Also, they may have conflict between couples, which lead to marital problems. And also, they experience stigma and discrimination by other parents at school, but teachers not help them to explain it and solve the problem. Lastly, there are 2 suggestions on the above problem. The first one is on ADHD assessment and treatment services. Most investment in the mental health services should be put on and alleviate the pressure of the public health system. More proper consultation and follow-up services to provide to them. Also, they need to increase the services on ADHD patient psychological needs. They want more on non-pharmacological options like counseling or small group intervention, so that they can learn to control emotion, practice social skills. And the second suggestion is on ADHD children parents' psychological needs. The first one is to start psychosocial education program and introduce basic concepts of the illness difficult in learning and social relationship about ADHD. The second one is the education intervention, which focus on parents' role, teaching, and help them to solve their daily life difficulties. Also, caregivers should receive counseling services from the mental health services.
Although there are applications of medical treatment for children with ADHD, there are negative side effects carried out by medicines. Therefore, we are going to introduce some non-pharmacological intervention for those ADHD students. The behavioral intervention is suggested for schools. Research showed that ADHD students reduce behavioral problem after the gain of cognitive-based intervention, instruction and behavioral management training for ADHD. The behavioral therapy is the most effective and common treatment which used to solve ADHD patients' behavior. We trace one's behavior through changing their mindsets. In school, teachers would be responsible for setting up rules and adjusting the classroom or school environment, which is called the antecedent-based strategy. Teachers set clean classroom rules and frequently praise students who are following the classroom rules. Reduce the length of assignment and praise students on task completion. Antecedent-based strategy aims to set conditions on preventing inattention and disruptive behaviors. The consequence-based strategy is recommended as the combined strategy with the antecedent-based strategy. Teachers use reinforcement as a stimulus for students to improve their self-management. For example, giving specific reward for students who have completed their own tasks. Parents also play an important role in helping ADHD students. The Positive Parenting Program, which is also called the P strategy, would be an option for ADHD intervention. The P strategy is known to be effective in treating ADHD students in Western countries. It includes 5 levels of interventions. Different level of intervention is applying for varied degree of intensity of the problem. This program focuses on preventing and reducing the emotional and behavioral problems in children by adjusting the family environment. It emphasizes the development of parents' self-regulation, including 4 aspects. The self-sufficiency, which mainly focus on building up the confidence in parents' parenting ability. The parental self-efficacy, so that the parents believe they can surpass the problem in parenting. The third, self-management, which means parents keep on improving parenting practice. And the last, personal agency, meaning that parents must learn to own the improvement in their family situation. Researchers in Hong Kong provide supporting evidence of the availability of P in Eastern culture. The research is based on the level 4 intervention. Results show that the intensity of children's disruptive behavior declined significantly, and the parental self-efficacy increased significantly. And the reduction of intensity of problem behavior has maintained to 3 months after the program. Now will be the summary of our presentation. In the previous slide, we see that the number of ADHD cases increased in Hong Kong. There are negative effects in school performance in ADHD students. Also in Hong Kong, there are lack of support for school children and parents. ADHD has been a concerning problem. We suggest using behavioral intervention in school, and it has been consistently used by other countries and showing positive effect on improving the situation. Also, the P strategy has shown that to be applicable and effective for Eastern countries. And this is the end of our presentation. Thank you.